Hi everyone, so I'm live now. Welcome to this week's Medic Mentor webinar. I'm Aniqa Ahmed and I'm a fourth year medical student. I'm also a presenter scholar with Medic Mentor for 2017 to 2018. Welcome everybody, I'm really glad to see you here. Oh, not many viewers right now, but this is live on YouTube, but you can watch it on your own time. Because it will stay uploaded on the Medic Mentor YouTube channel. So today's topic, or this week's topic, is what is medical school really like? I remember when I first started applying for medicine, or when I decided that medicine was for me, I didn't really know what medical school was and what I would be doing on a day-to-day basis. Even with a doctor, I didn't really know what a doctor did apart from cure illness and make loads of money, but that's not true. The only doctor I knew was my GP, I think, at the time. Yes, that's correct. So I think it's really important to understand what you're going to be doing for the next 5 years, because it's a long time. You're investing not only your time, 5 years, but £45,000 of your money. If you're an English student, I'm an English student, so yeah, that's my student loan. It's extortionate, and I think having a good understanding of what you're going to be doing on a day-to-day basis, it'll be great, because in interviews, if it comes up, I know some of you will be going through interviews right now, you'll sound really competent and knowledgeable and bit more distinct than the other students if you know what the basic overview of the 5 years are going to be like. So today I'm going to be discussing what a day-to-day life is in medical school, but also just the broad overview of what the 5 years are like. As I'm a fourth year, as I said in the beginning of this video, I think I've got a really good understanding and appreciation of what medical school is actually like. It's not as glamorous as you might think it is. No, not at all glamorous. I think the glamour will come later on. That's what I'm telling myself. Um, so yeah, let's get started. So every medical school is different in the UK, of course, and invariably people will have different experiences, but most people have similar experiences. I mean, I'm talking about myself and all of my colleagues and my best friends. I've spoke to them and we all have very similar experiences. I'm not saying this is going to be the experience that you're going to have, but I'll give you an overview. I think I'm repeating myself way too much, but yeah, let's just dive in. So a normal undergraduate degree is 5 years. So I'm just going to use my hand. So the first 2 years of medical school is what we call preclinical. So year 1 and year 2, that's preclinical, and you learn all the basic science in those 2 years. And you spend majority of your time in libraries, in a lecture theatre, in labs, just learning basically, using your books. And the last 3 years, year 3, 4, and 5, you spend most of your time in the hospital shadowing all the doctors, ranging from really junior doctors to really senior doctors, including surgeons. And you learn on the go, basically, and you get a real taste of what your life is going to be for the next 40 odd years, because medicine is a career for life. So yeah, that's 5 years. There are some universities that have 6 years, like Oxford, Cambridge, Imperial, they have 6 years, and I'll tell you why they have that extra 1 year later on throughout the video. So yeah, like I said, I'm going to be talking about right now about the first 2 years. What do you do in the first 2 years? So you learn all the basic science, human biology, human pathology, diseases, and you've probably heard of traditional based curriculum and PBL. Traditional is basically the way they were teaching medicine to medical students in the past 10 to 15 years, I'd say, and it's changed now. More universities are migrating towards this new style of learning and teaching, which is PBL. So I think where the main differences lie are the first 2 years, okay? Because the last 3 years you're based in hospitals, and that doesn't really change no matter what type of curriculum or what university you're going to. You're in the hospital, that's basically it. But the first 2 years are really different if you're doing traditional or PBL. I'm at a PBL universities and I love it. I thought I would hate it, but I actually really, really do enjoy it. So yeah, let's talk about traditional first. So traditional is what they call spoon feeding. It's quite patronizing actually, but it's not really spoon feeding. It's more like school. hence the word traditional. It's the way most people have learnt their whole lives. So you're in a classroom, or what we call a lecture theatre, depending on how big your cohort is. I've got 310 students at my universities, so we sit in really, really big lecture theatres, 310 of us, and the setup is very similar, like a cinema, rows and rows and rows of chairs, and at the front is the big projector, and there's a professor or a scientist or a doctor at the front teaching you the content. Just like a classroom, they'll be talking throughout. You don't really get much time to ask questions or interact, you're just being taught, okay? And you basically do that 9 a.m. to 5 p.m. pretty much every day if you're in a traditional university. For example, Oxford, Cambridge, Imperial. There are other traditional universities. I'll let you look that up, which ones are and which ones are not. So yeah, that's 9 to 5. It's very intense, but the pros with that is you know exactly what you're learning and what you need to learn, because it's all there and it's all being spoon-fed to you. Oh, I hate that term, but I think it's the term everybody uses and identifies with. So you're given lectures all the time, basically. You also have small group teaching, which we call seminars, and you're given a topic and you talk through that with a professor or a doctor in small groups. They last around an hour or more, but yeah, the first 2 years in a traditional university, basically being taught a lot of basic science, and the way that's taught is different. So in a traditional university, what they'll say is, oh, let's focus on the heart today or this week, and they'll just give you so much information about the heart. I mean, it's not information overload, you need that information, but they teach it to you in a science way. So talk about the heart, all about the anatomy. So anatomy means the way the body is organized within the body. So for example, you've done this in A-level biology, I'm sure, or GCSE biology. For example, the heart, we know there's 2 atria, there are 2 ventricles, there are blood vessels, there are nerves, there's muscles, there's other organs surrounding it, and that's what anatomy is, basically how the body is organized. What was my point? Okay, yeah, that's what I mean. In traditional based curriculums, they teach you in that sort of way. It's more regimental, whereas in a PBL course like me, they will teach you about the heart, but they'll teach it to you in a clinical way. So they'll give you a case to work through. So they'll say, Mr. Smith is a 90-year-old man, he's having chest pains, he's a smoker for the past 30 years, he's obese, etc., etc. And they'll give you a case, and you have to learn all about the heart surrounding that case. So that case will indicate things like a heart attack, maybe, and what other disease there are. And you learn all the diseases and all about the human body through that one case. That's the difference. So you can open up a textbook, learn all about the heart, or, which is traditional, or PBL, you learn about the heart in a very clinical sort of way. And that's the main difference. Also, in traditional based universities, a lot of it, like I said, is taught to you, whereas in PBL, like I'm doing now, is you have to do a lot of the work yourself. So you're given a bit of guidance, a few learning outcomes, and a few pointers here and there, but most of it you learn by yourself, using books that this university recommend you, using the few lectures that they do give you. You do get lectures in PBL universities, you use those as well. You just use as many resources as you possibly can, whereas in traditional universities, they basically just use the lectures that they're given, from my understanding and what I've found from all of my friends. So yeah, that's how that's taught. Also, there's clinical skills in the first 2 years. By the way, I'm still in the first 2 years of medical school. There's labs you go in, and this is my favorite aspect of medicine, because you really feel like you're a doctor and you're doing something instead of learning all the time, because it really does feel like you're learning all the time. You know, they say it's lifelong learning. It's not a lie. It's true. It is lifelong learning. Clinical skills, okay, and that's just basic procedures that you need to be able to perform as a doctor. So that's like taking bloods, administering oxygen, giving injections, making up drugs. Is so fun. And first you do it in a lab in your university on dummies. So you give injections in these plastic arms, you take bloods from these plastic arms, you give oxygen to plastic models. So you're really prepared when you go into the clinical experience in year 3, 4, and 5, and you know what you're doing. So you can practice as much as you want in those labs, which is really useful. So you know what you're doing. Yeah, and I'm in year 4 and I still don't get bored of taking bloods. I don't know, it's always exciting, and it's really different on a real patient. It's nothing like the dummy, which is quite sad. But it's a way to get experience. So that's the first 2 years. There's lectures, there's seminars, there's lab skills, all the basic learning. So what do you do after you do those first 2 years? You then transition into your clinical years, and here is exactly what you're going to be doing for the rest of your life. You're in the hospital pretty much all day, every day. There are a few lectures here and there, but not many at all. You're basically in the hospital all the time. And depending on what rotation you're on, it depends what time you start. So throughout the whole 3 years, you go through different rotations and different specialties. So you get a really broad understanding of what different specialties there are. So this year, for example, I've done obstetrics and gynecology, I've done pediatrics, I've done ophthalmology, and I've done neurology. Whereas when I was in year 3, I did emergency medicine in A&E, which has been my favourite so far, and chronic disease. So chronic disease means just illnesses that stay with you for a really long time and they're not really curable. So for example, like diabetes or heart disease. I did that. What else did I do? Oh, I also did oncology, which is cancer, which again is a type of chronic disease. So you can really see the differences in the years. It's always exciting. You're always learning something new, which is amazing. That's what you do for 3 years, and you're shadowing the doctors all the time. And the biggest difference is in PBL and traditional. In the last 3 years, you're basically left on your own, doing your own thing, and really you're just put in the deep end. I remember when we all went into our 3rd year, because the first 2 years is really nice. You're with all your friends, all your colleagues. You have a timetable, you know what you're doing. There's guidance there, there's support there. But once you're in your 3rd year, no matter where you are, whether you're in a PBL course or a traditional course, trust me, you're left alone, flailing. You've got to learn on the go. Have you seen like ducks, when the little ducklings, they're just put in the water and they have to learn to swim? That's going to be you in 3rd year. But don't worry, it's nothing to be frightened of. Find comfort in knowing that everybody has been through that and is going through that with you, so you're not alone. So yeah, you rock up around 9 a.m. if you're on a medical specialty, and you follow the doctors on a ward round. So you're in a ward and there's so many patients there, and you need to take a history from them and see what's changed in their medical, what am I trying to say, in terms of their health, and if any changes need to be made, or if no changes need to be made, or if they need to be discharged and sent home. So you go around with junior doctors and also consultants or senior doctors, and the consultants will tell you jobs X, Y, and Z need to be done. The consultants then leave and make sure that all the junior doctors or the doctors just below the consultants get those jobs done. And as a medical student, you're right at the bottom of the pyramid anyway, but you also can get involved and do all the jobs if it's within your remit and within your abilities. So when I'm on ward rounds, I really try to get stuck in and involved, because that's the best way to learn. You ask them, is there anything I can do? And they'll give you jobs like, yeah, take bloods from this patient, or go take a quick history from this patient, or do this, this, and that. Okay, so that's what you do in the 3rd year. Also, what you do in your 3rd years, 4th years, and 5th years, actually, I shouldn't just say 3rd year, in all those 3 clinical years, is what we call clerking patients. And this is one of the best ways to learn, I think. So every patient that comes into hospital, you need to take a full history and a full exam on them as a baseline, so you know exactly what you're working with as a patient's just come in. And normally the junior doctors will do that, but as a medical student, you're meant to do it as well, because that's going to be your job in a few years' time. And you either do it alone, or a doctor can watch you do it and give you feedback at the same time. It's a really struggle at the beginning, but again, as with anything, you get used to it and you get better over time. So yeah, you clock patients, you do all the jobs that you need to do, and basically just follow the doctors around. There is a lot of awkward standing and not knowing what to do with yourself. I'm not going to lie, it's not glam at all, because you really are at the bottom of the pyramid and you feel so useless and like you don't know anything, because pretty much you don't know anything, because even though you've learnt all of the content in the past 2 years, bringing it into practice is something totally different. Like I said before, find comfort in knowing that everyone has been through it. Even, you know, your idol doctor that you see who's great, they've been through it as well, making mistakes and blunders left, right, center. That's what it's all about, and that's the best way you learn. So how do you know what you need to learn? Now, in A-levels and biology, not A-levels and biology, what am I saying? In A-levels and GCSE, you have exam boards, right? And curriculum. So you have AQA, you've got EdXL, you've got OCR, etc., etc., etc. And they've got a specification. And if you follow that specification, you won't go far too wrong, and you just learn all of that. Whereas medical school is different in terms of every university sets its own exam questions, sets its own exams, and curriculum in a way. We've got what we call the GMC. That's an independent organisation that monitors every single medical school in the UK, all the medical students and all the doctors. It's basically like the police, but for medicine, just to make sure that we're all on track. And they set out guidelines like a doctor should be able to do this, a doctor should be able to do that, a doctor should be able to do this, 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 and this. And every university takes those guidelines and then tailors their own curriculum based on that. Okay, so there isn't a thing like a specification or a mark scheme as such. Yeah, it's not like that. It's really different. I remember when I was in A-levels and GCSE, I kind of just learnt the mark scheme, and that was all I needed to do. Whereas in medicine, it's different. You've got to learn so much more outside what the university tells you need to learn. There's so much you need to learn, and there are so many exams in medicine, as I'm sure you all know. The amount of exams you get is different based on the university you go to. For example, I think Birmingham, they have an exam every month, but there are other universities that have just one exam right at the end of the year. I go to a university that has 3 exams throughout the whole year. So yeah, it's really, really different. And it's not like modules in terms of you can just learn that and then forget about it, like at GCSE and A-levels. Actually, no, I'm mistaken. I'm sorry. They've changed the curriculum now, haven't they? So you kind of have to learn everything and do the test right at the end. And I'll just show you. You might think, oh, in A-levels and in GCSE, you've got these books, and how are you ever going to get through those? Right, let me show you what a book looks like in medicine. This gives me nightmares and headaches. This is a huge textbook that we have to get through. Look at it. Not many pictures and a whole lot of writing, and that's just one of the books. So there are other books that are more specific. So I'm doing pediatrics. When I did that 4 weeks ago, and I needed a whole book the same size as this, and I had to get through that. So there's a lot of things to get through in medicine. I think before I started medicine, a lot of people told me and scared me, because I don't know, or even right now, I don't know anybody in my family or within my friends outside of university who are doctors or studied medicine. So when I used to say, oh, I'm going for medicine, people used to go, oh, that's really hard. You're never going to get any sleep. You're not going to have a social life. It's going to be so difficult. And I thought, oh gosh, it really is. I mean, I'm struggling with my A-levels. How am I going to study medicine, and how am I going to become a doctor? But I want to, assure you all that it's really not as difficult as everybody makes it out to be. Let's say A-level biology is here. Okay, I'd say medicine is about here. It's a tiny step up. The major difference is the content and the sheer volume of things you need to learn. I think that's the main difference. But I think the content itself isn't too difficult to wrap your head around. But yeah, you need to invest a lot of time into medicine. You've got a whole day in university or in clinics or in the hospital, and you've got to come home and you've got to solidify everything you've learned. And you've got to keep coming back to it because everything is relevant. Even though you're doing, let's say you're doing cardiology, so about the heart, still, even though you did kidneys last year, that's still relevant because when a patient comes in, they're not just going to come with one problem or just the heart. Most likely they'll have loads of other disease. So you need to have a real understanding of a lot of medicine and have a broad understanding of a lot of the topics. So yeah, that's the hardest thing about medicine, is the sheer volume and the time and dedication you need to invest in it. But it is worth it at the end of the day. It sounds really cliche, but you're here to help people, help patients, and it's so rewarding. Everybody uses that word rewarding. It's so cringe because everyone uses it, but they use it because it's true. And yeah, in the beginning, I didn't really enjoy medicine. I found it like, oh, it was a bit of a slog, because there was so much learning. And also another big difference in PBL and traditional, you see patients in your third year in traditional university. So the first 2 years, you don't really see a patient at all. Whereas in PBL courses or newer courses, you get early patient contact from starting from year 1, and depends on what that entails. You might think that's a lot of clinical experience, but really it's not a lot. Most likely it's about once a week in a GP practice, or you see a patient. So it's not a lot, but it's better than nothing. So yeah, you see patients in your I saw patients in my first year, second year. So when I first saw them in a hospital setting, it wasn't as scary because I had already spoken to a lot of patients before that. Sorry, I didn't mention that earlier. I'm just looking down here because I've written all the things I want to highlight, and I want to make sure I haven't, forgotten anything. Okay, when I said how universities for an undergraduate course are 5 years or they're 6 years. For example, Oxford, Cambridge, Imperial, they have 6 years. Now, the reason why they have that is because they have an extra year where you take a break from medicine and you study something that is still medical related, but it isn't medicine. And you get to choose what that is if you've got a special interest. And by the end of that 1 year, you get a degree, which is really great. So it's basically a double degree. So in those 6 years, you get a degree in medicine and you get an additional degree in what you did in your intercalated year. And the difference between the 6-year courses is the fact that this year is compulsory, whereas in other universities, it's voluntary. It's up to you. I personally didn't take a intercalated year, but I've got loads of friends who have, and they're really enjoying it. So it depends how interested you are in a certain subject. But yeah, if you're at a university where you have to do it, then you haven't got much choice in terms of doing it. You have to do it, but you've got a lot of choice in what you want to do. So let's say you're really interested in, let's say, the immune system. Then you take a whole year out and you learn about the immune system in a lot of detail. And at the end, you come up with a degree in immunology, which is great. With the intercalated year, you can either stay at your university and do it at your university. So let's say you go to King's, you can do your intercalated year at King's, or you can go external, go to another university and do that year at a different university, which is an option there. But then you'd have to come back and finish your medical degree. And it's a great opportunity to do something different. I know a lot of people who loved the intercalated year because it was different to medicine, and it gave them a chance to wrap their head around medicine, because even though 5 years is a long time, it kind of goes really quickly because there's so much responsibility. You feel like you're never really ready to face the world and become a doctor. But yeah, so that's an option there. That's one thing I want to say you can do at university. There is so much opportunity in medical schools, not just medical related. Oh my gosh, I can't even begin to tell you how much stuff you can do at university in terms of social events. There are so many things that you can explore. You know how at school and at college and sixth form you have clubs, after school clubs and lunchtime clubs. You have that at university, but times 100 in terms of they are epic. They can be medical related, so you can have like cardiology club, but we don't call them clubs in university, we call them societies. I don't know why. I think we just want to act a bit more sophisticated and more adult-like if we call them societies. You can join those societies, and you can join as many as you want, depending on how much time you've got to spare. And there are non-medical related ones. There are some great ones. There's like Harry Potter Society, Manga Society, K-pop Society. Think of a topic and there'll be a society for it. Debate society, there's religious societies like Christian Society, Islamic Society. There are so many things, and the great thing is if there's a society in mind that you have and it doesn't exist, you can become the founder and begin the society, which is great because not only does it look great on your CV, I mean, you're like the CEO of this society. Not only do you get involved in these societies, you can be on the committee. So I do that. I'm on the committee for a lot of medical societies because I'm a very non-well-rounded individual. I should really venture out of medicine, but most of the things I do are medical related, which is really bad. So yeah, that's another thing you do at university. Oh my gosh, my battery is running out, so I'm gonna quickly go get my charger. Embarrassing. Sorry guys, I'm gonna have to move you all so I can get my charger. I did charge my laptop, but for some reason it's not great. Okay, I'm gonna have to stand like this. So, what was I saying? Oh gosh, can I do this properly? I'm really sorry about this, guys. How unprofessional. Oh my gosh, you can tell I'm not a YouTuber and I'm not into this. But so yeah, lots of non-academic opportunities as well at university. One thing I'd like to say is that the experience of, oh my gosh, my battery isn't on. Let me switch this on. Oh Lord. Okay. We're done. This is it. Okay. Yeah, it's not as glamorous as you might think. You know, when you watch TV, most of the information I got was from TV, which is a very unreliable and inaccurate source, as we all know. It's not like that. You know, you see on these TV programs, all the doctors are basically models, and you've got Dr. McDreamy, you know, from Grey's Anatomy. Yeah, it's not like that. So sorry to break the bubble there and all your hopes and dreams, but yeah, it's not like that. I'm going to dive back into what you're going to be doing in medical school in years 3, 4, and 5. I said you have medical ward rounds, but I didn't explore the surgical aspect to it. So there are surgical rotations as well, which is really interesting because you get to go into theatre and see all these great surgeries. You get to see classic surgeries where they make cuts through the abdomen or, you know, right down the chest, to brain surgery, but you get to see really cool surgeries where they use robots. One of the robotic surgeries I saw was on prostate cancer. It was so interesting. I couldn't believe it. How fine and how advanced the medical field really is. And I mean, we're in the UK, so this is NHS funded. So just think about the possibilities that exist in America and other parts of the world. So yeah, and surgical ward rounds and surgical rotations start a lot earlier. So all you budding surgeons out there, you've got to bear that in mind when you choose your careers. So like I said, medical ward rounds start around 9 AM. Surgical rotations start around 7 to 8 AM, really early, and you've got surgeries throughout the whole day. Also in hospitals, you attend clinics. So you know when you attend a GP, it's all general medicine. You can go in with any presenting problem at a GP, but the GPs then can refer you on if the presenting complaint requires a consultant's attention or a more senior specialist attention. They'll send you into the clinic in hospital, and that's very specialist. So you'll have a lung clinic or a heart clinic or a kidney clinic, and you go in with all your problems there, so it's more specialized. So you get to sit in those as a medical student with senior doctors and consultants, and it's a really great way to learn because it has a community sort of feel, and you get the opportunity to really explore each patient with the doctor. The doctor can see you do exams on these patients, and you get to do some skills, so like listen to a patient's heart and tell the doctor like what you can hear and what you can't hear, and they can rectify your technique if your technique's really bad. But yeah, that's some of the things that you do in the hospital. I'm trying to think what else you do. If I go back to years 1 and 2, it's basically just learning. You just learn as much as you can. You've got to be keen, because if you think about it, when you're going into medical school, most likely you're the cleverest person coming from your school. You're the A-star student, the student who gets 100% in probably everything. You're the overachiever. But when you go into medical school, everyone is brilliant. Everyone is a mini Einstein. So you kind of feel like you're diluted out by all these great players, but that's normal. There's nothing to be afraid of. Everyone is there for a reason. So if you're there, don't feel inferior. You're there, so stand your ground, work hard, put in the time, and you'll get there, because there's nothing, I don't believe in somebody being really clever. I've seen it firsthand. It doesn't matter how clever you are. It's all about how much effort you put in and how much work you put in. So you've really got to put in the work if you want to be a competitive medical student, really, because in medicine there's no such thing as A stars, A's, B's, C's. You don't get grades like that. Actually, the way you get grades is through a percentage, and on that percentage you get a ranking, which is so cringe because you get ranked throughout your whole medical career. In medical school, I mean. So there are 310 students in my year, and I know exactly where I sit in those 310 students. So I could be number 1, or I could be number 310, or I could be in the middle or whatnot. So you know exactly how you're doing, which kind of feeds the competitiveness even more and the competition even more. But I personally, I'm not a competitive person at all. I never have been. And I think that's the best way to be in medical school, because you can really get eaten away by how you're doing in terms of Harry and Larry. But just put your blinkers on. Don't care about Harry and Larry are doing, because that's not going to help you, and that's not going to bump up your ranking or your grades. So that's one thing to bear in mind. Don't be afraid that you're going to be diluted out by all these overachievers. It's fine. It's the way of life. There'll always be somebody better than you. There'll always be somebody worse than you. So I believe in that, and you'll be fine. So don't be afraid of the competition. Don't think that you're not good enough, because if you're in, that means you are good enough. You've got something to bring. Everyone is unique. Nobody is number 1 in everything. Failure is a normal part of life, and it definitely is a normal part of medicine. I think there's a saying that every person in medical school at least fails 1 exam, at least, okay, minimum. So it's not a big deal. You get up, you try again. So yeah, the first 2 years, I'm trying to think if there's anything else I can say in terms of what you do in the first 2 years. No, just a lot of learning. And the last 3 years, you're left on your own in the big wide world. That's the good thing about PBL, actually, because I'm in PBL, we were kind of left alone right from the beginning. We're given a little bit of guidance, and the rest of it we have to learn by ourselves. So we adapt pretty quickly to being self-sufficient, whereas in traditional courses, they get that transition in their 2nd year, so a bit later on, because they're so used to being taught everything, and then they're sent into the 3rd year, they're like, oh gosh, I'm all on my own, and it's a bit more scary, actually. But invariably, all the students have to, persevere and get through it. I'm trying to think if I've got anything else here. No, I don't actually. It's been 34 minutes since I've started. One more thing I'll discuss in terms of medical school it's really important to read about what your medical school is like. If you're applying, because I'm guessing you're all prospective students here, you need to really read up exactly what your medical school offers and what the medical school that you're applying to, what the curriculum is like, because a lot of students are caught up in interviews because they will ask, I think the most basic question and the most common question is, why this medical school? And you really need to know. It's really boring, I know, but you have to learn it. Go on the website, read their prospectuses, it's all there. So what the first 2 years are going to be like, and what the last 3 years are going to be like, and if there is an intercalation year included in that too, and you're basically done. Another thing actually I haven't talked about is the way they teach anatomy. Now, 10 to 15 years ago, most of the way that medical schools would teach anatomy is through the classic method of you get given a dead body, which we call a cadaver, and when that person was alive, they donated their body to medicine and the medical field for us students to learn from, which is a really great privilege and honor. And you learn via that. You get given this cadaver and you cut through and you do everything by yourself. That's one way, and that's becoming more and more rare, which is very sad. The second way is what we call prosection. Okay, sorry, the first way, that was called dissection, anatomy by dissection, because you dissect yourself. And the second way is anatomy by prosection, and that's when the human organs are actually cut out for you, and then the structure is right in front of you, and you just learn just by looking at it and viewing it and prodding it a bit here and there. I'm sure you can appreciate how different the two experiences are. My university offered full body dissection, which I loved. I mean, it was great. It's such a shame that it's becoming more and more scarce now. So I would really recommend, if you get offers from a few universities, if a university offers anatomy by dissection, that would be a great option to go for if you're interested in that, because it's a really great way of learning, because you're cutting it all by yourself. I don't think I'll ever forget when I did dissection, I actually cut the ribs out myself, as in how do I use the term? I used like spanners, not spanners, pliers, to really cut through all the ribs, spread it apart, move the lungs aside, and I pull the heart out. I mean, that was such a great experience, okay? And you don't get that with prosection, unfortunately. However, there are pros and cons with everything. So the pros with that, with anatomy by dissection, is that you do everything yourself. You get a hands-on experience, but the cons to that is you're very junior, you don't really know what you're doing, and you can miss major structures. You might think, oh, what is this? It's just a little thing, but actually it's probably a major artery or vessel that you just cannot appreciate because you're so, low in your understanding at that point. Whereas with prosection, it's really highlighted, this is important, this is the organ, you need to know this, 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 and this. So that's the pro with that. Either way, you will learn the anatomy. You don't just learn by doing that. You also learn when you go into surgery, when you're in your year 3, year 4, and year 5, you get to see surgery, and it's a great way to learn anatomy too. There's also books online. You can read books online, and you can also just read books. You can watch videos on YouTube, you can watch TV programs. There's so many ways to learn anatomy. I'll show you one of the books I use that's recommended by our university. So this is a book just all about anatomy, and it's a great way to learn. That's the thing about university. There are so many ways to learn. There are apps on the iPad. You'd be astounded by how great they are. You can learn via those. One of the biggest ways I learn is actually through watching videos on YouTube. So there are 2 main YouTube channels that I use, and I think most medical students use, called Khan Academy or Osmosis, and they've got the most amazing and brilliant lessons there. So what you'd learn in an hour at university via a lecture, you can learn in about 10 minutes by watching one of these videos. It's absolutely crazy. So what I do is, if I'm learning about a particular subject, for example, I was doing epilepsy for the past week. So instead of reading loads and loads of books, I mean, I showed you that huge, massive book, that green one that gives me a headache just looking at it. Instead of trawling through those pages, I just watched a 10-minute video on this osmosis website that I just mentioned. I watched that for 10 minutes. I got a really broad understanding of what the subject entails, and then I go to the books, okay? And that's a great way to learn, and that's how a lot of medical students actually learn. They watch a short clip and then they learn, they make notes and they read all the text. I've got other friends who actually only watch videos. They don't even read books, which is fine, whichever way you learn. Another thing I want to highlight is the exam. I'm just sorry, I'm looking at the time, 40 minutes, so just to make sure I'm not going over, is how the exams are done. So you don't have a lot of written exams in university. Most of the exams are actually multiple choice based questions. So there are three main types. There are single best answers, MCQs, and EMQs. Now, single best answers, or SBAs, you get given a question and you get 5 options, and you just choose one of them as the correct answer. That's SBA, okay? Just one of them is right. And then you get MCQs and EMQs. So you get given a question, and there isn't just one right answer. There are a few right answers, and you choose those. And that's how a lot of medicine is examined. You also have things like vivas. So what that means is that a viva could be in terms of anatomy. So you're put into the lab and you're shown a structure, and they tell you, okay, so what is this? What is this? What is it? What am I pointing to now? What am I pointing to now? It could be an artery, a vessel, or whatever it is, something important. You also have something you call OSCEs, which are exams, which I've got at the end of this year, which is really terrifying. These are practical exams. So you go from station to station to station, and each station has a different patient in, and you've basically got to act like a doctor, go in there, take a history, do an exam, and then come up with a plan, do a few procedures, and that's your exam. And you're watched by a doctor doing all this, and they grill you and they examine you, and it's really terrifying, but everyone goes through it, so it's fine. So that's what we call OSCEs. It's really different. Like I said, some universities have one exam right at the end of the year. Other universities have exams all the time, like every single month, which is, depends how you work. Don't be put off by it, because in the end of the day, everyone has to learn the medicine. You're all going to be doctors in the end of the day, and you just got to flourish in whatever environment you're in, really. Anything else that I've put down? So just to summarize what I've said in the past 45 minutes, 5 years of medical school, or 6 years if you've got that additional intercalation year. First 2 years are preclinical, where you learn basic human biology and human science, pathophysiology, anatomy, chemistry, biochemistry, pharmacology, how drugs work and all of that, clinical skills, lab skills. Mainly you're set in libraries, lecture theatres, and seminar rooms. That's 2 years done. The other 3 years, you're in the hospital and you're learning on the go. And you're basically getting the feel of what your life is going to be like as a junior doctor, with not a lot of guidance. So that's the 5 years summed up, and the additional year of intercalated year. That's different depending on what you do, but most of that is all written based and essay based. It's not really, you don't really get to see a lot of patients in that year, from what I know. So yeah, that's the 5 years summed up. And in the year 3, 4, and 5, most of that is in the hospital, and you're shadowing all the doctors, ranging from junior doctors to the consultants and surgeons. You sit in on their clinics, you get taught by the bedside. and there's no official teaching schedule, so you kind of just have to rock up and hope to learn something and then come home and then consolidate all your learning and really be in control, because you're adults, you're treated like adults, and you're expected to do it all by yourself by the third year. Don't worry too much about it. When the time comes, you'll manage. It's fine. I hope you found this video useful. That's 45 minutes done, I think. And please send your questions through. I think the biggest advantage of watching this live is you can send any question through and hopefully we can answer it. Whereas if you watch it in your own time, you don't really get the advantage of asking your questions and the satisfaction of getting them answered straight away. So I'm just going to click off and see if I can see any of the questions. Let's see. Okay, I can't see the questions. Let's see. Aha, I can see the questions. Oh, Ian is here, Dr. Kennedy. He's answering a lot of the questions. I can see the questions. I need to make this. Oh, Ian is here, Dr. Kennedy. He's answering a lot of the questions. Oh, Ian is here, Dr. Kennedy. He's answering a lot of the questions. Wow, there are so many questions, guys. I'm so impressed. Wow, there are so many questions, guys. I'm so impressed. If you've got any questions, please send them through. Wow, there are so many questions, guys. I'm so impressed. If you've got any questions, please send them through. Okay, I've got a question saying, any tips on the UK CAT exam? I don't think I've mentioned this, but I am a gap year student, so I did the UK CAT twice. Saying, any tips on the UK CAT I think I'm doubling up. Oh gosh. On the UK CAT. So I did the UK CAT twice. One of them I did when I was in year 13, and I didn't do very well because I just didn't prepare at all. People told me, oh, you can't prepare for UK CAT because it's an IQ exam, you just go in there and you do it. And I took their advice as literal, and I just rocked up to this exam, which is done in the local driving theory test centre. And I did awful. I think my score was about 500 and something. I don't know, it was absolutely terrible. And when I applied again to medicine, I prepared so much. I used a book that I bought from Amazon, and I just went through that all the time, and I got a really, really high score, nearly 800 for my second round. So the best way to go forward is to prepare, prepare, prepare. I know that's such a terrible answer, and it's not probably what you're looking for. You want an easy way out and a quick fix, but I'm telling you, all those people that get the highest marks are the ones that prepared the most. Medical school is a game, and entering medical school, it's a game. You've just got to win at this game by preparing, 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 and practicing, practicing, practicing. Don't believe a single word from somebody who says, oh, I didn't work hard, I didn't really do much. No, they're lying to you. They've all worked hard. By nature, they're keen. So if you want to know exactly the one I used the 600 UK CAT questions. I think that was the classic one that most people use. But because I did it a few years back, I'm not sure if that's still updated or if there are new ones. There are lots of courses that you can attend. 6med is a company that offers UK CAT courses, and they have books as well. So if you go onto their website, you can go to one of these courses if you think that will be useful to you. But yeah, it's up to you. You can attend a course or you can buy a book and read through that. Let's see if there are any other questions. I think Dr. Kennedy's like answering them all for me, which is absolutely fantastic, actually. Um, um, I've got a question. Which university do I go to? Unfortunately, I'm not comfortable putting that information out on a public platform. I hope you understand. Do you have any tips for MMI interviews? Again, the same theme: practice, practice, practice. Oh my gosh, honestly, you just need to practice all the time. There are recurrent themes that come into medicine, and you can basically kind of guess what answer they want from you by the question. So they'll ask you the same question in really different ways. So one of the examples I have is they'll ask you, what is your biggest weakness? But they'll say something along the lines of, if you could change something about yourself, what would you change? And if you think about it, they sound really different, but they're asking the same question. So the main thing is to identify the theme and really think about what they're asking you and then answer that, because most of the questions are the same. I mean, there's not much else they can ask you in terms of the questions. It's all the same themes, and just practice those. Practice in front of a mirror, practice in front of your parents, practice at school in with a teacher. If you go on the Medic Mentor website, there are so many resources that have mark schemes and questions that you can go through yourself. So I would do those and have a look at that. So practice, practice, practice. There are MMI courses or interview courses that you can go. I've got friends who went to like 3 MMI courses. I personally didn't go to a single one. I just prepared by myself at home using online resources, and Medic Mentor is a great source for those. Work experience I got prior to medical school. I had quite a lot of work experience, but not a lot of hospital-based ones. The biggest misconception people have when they apply for medicine is they think it's all about quantity. I don't know if you watch X Factor, but Simon Cowell always bangs about it's about quality, not quantity, and he's right. It really is about quantity and how you describe what you learn from those work experiences. So I did 2 days at a hospital, and that is it. And I got in touch with that hospital myself. Oh no, I didn't. I think that I'm getting a bit confused. Well, anyway, I got 2 days in a hospital, which isn't a lot if you think about it, and that was with doctors. And the rest of my work experience was all in the community. So a care home, a disability home, old people's home. Oh, the same as a care home. I worked with soap and a palliative care. I worked in a charity shop as well. I had a lot of experience in the community, and that's more what they're looking for at universities nowadays, from what I gather. They want to see that commitment to medicine, because anybody can do 2 days or 5 days in a hospital, but really, what do you learn from that, and what do you show with that? Okay, yes, I went into the hospital, I saw this, 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 and this procedure, but that doesn't really make you a candidate for medicine, because anybody could do that. What makes you a candidate for medicine is how committed you are and what you learn. So I did like a year or a year and a half in each of these places. I really dedicated my time, and I highlighted that in all of my interviews when they asked me. So you need to say what you learned from those experiences. There's no point you saying I did A, I did B, I did C, I did D, E, F, G, H. I mean, it all sounds great, but what exactly did you learn from that, and how does it relate back to medicine? The key point is relate it back to medicine. So I worked in a care home. What did I learn from that, and how does that make me a good medical candidate and a good, potential doctor? And if you say those points, you're basically done in terms of your work experience, because with work experience, they want to see your commitment and whether you have a good understanding of what commitment to caring is actually like. Oh, Dr. Kennedy's written it, and I'm just saying it. Yeah, what you learned, not what you did. Honestly, so many personal statements I've seen. They say, "Oh, I shadowed Dr. Smith, and I saw this," and then that's it. They didn't say anything that they learned from that, which is a real shame because there's some great opportunities. You can turn any opportunity into something you learn. It doesn't have to be outstanding and groundbreaking and great, like I saw, brain surgery whilst I was on the moon. Okay, you just highlight what did you learn, and you won't go far wrong. What did I do during my gap year? So because I got all of my grades the first year round, I didn't have to do any extra exams, and all my offers were unconditional, which was really great actually. So I just prepared for interviews in that year. I did my UK CAT again, which didn't take a lot of my time. I had 3 jobs in one go. I worked in retail, WH Smith, Asda, and and Boots. I had 3 jobs, and then after that, I went traveling, stayed at home as well, visited family. So yeah, I just had fun in my gap year, which is different. If you've got exams to resit, then of course that would be different. But me personally, I didn't have to do much, which was really great. So, how long did you work in the care home? Would you say after Christmas is too late for me to start looking? Um, Depends. If you're in year 12, then after Christmas is great. But if you're in year 13 and you've already put your applications in, then definitely too late. Yep, year 12. After Christmas, absolutely fantastic. If you're after Christmas and you do it for about 6 months, I think that's more than enough. Or until you submit your application. So that will be a good 11 months. So yeah, fine. Did I write about my jobs in my personal statement? No, I did not, because actually, what you'll find is that 4,000 characters in your personal statement is nowhere near enough. I mean, you think 4,000, oh my God, how am I going to get through it? But you burn through those characters so quickly. So what I did, I put it in my reference that my sixth form sent out. Everybody has to have a reference that the university requires, and I spoke about it in my interview. I'm just going to go to the top and see if I've missed any major questions. Are there any books you would recommend? I just read Do No Harm and The Other Side. Okay, right. Now, these are one of my pet peeves because when I was in year 12, I was told by my sixth form tutor, he was a lovely guy, but he told me you need to read a book. And I was so stressed. I was like, what does he mean I need to read a book? What, Hunger Games, Twilight, Harry Potter? And he was like, no, you need to read a medical book. And I was like, what, a medical, like a textbook? What do I read? And he said, no, a book about medicine. So I just Googled this because I really didn't know what he was talking about. And it was books like you've just mentioned, like Do No Harm and The Other Side. I personally, I would read those, but I wouldn't mention those in your interviews because there are so much more things you can talk about in your personal statements. And reading this book, I don't really know what you can show, what you've learned from it, apart from that you've read a book and you've got a bit of knowledge about this book. Um, so yeah, you can read those books, but I personally, um, I wouldn't put those in your interview. I would read other books. Medic Mentor have great books, and really, I'm not plugging Medic Mentor because I'm part of them and I work closely with them. I'm only plugging this because they are such great books, and I wish I had those books when I was starting out applying, because I think I wouldn't have failed the first time round. But they've got loads of books on wider reading, NHS structure, Hippocratic Oath, and all of those things. So yeah, I would read those books, and they tell you about the medical school application process rather than reading a book about, medicine. Oh, you can't hear anything. Oh no. Can you hear now? Please say yes if you can hear. Dr. Kennedy's said exactly what I said. No prizes for being able to read. It's a transferable skill. Oh, how long did I work in the care home? Over a year. Any more questions, guys? Send them through, whether about the medical school application process or what medicine is like. Um, I can answer those all. I'll just wait. When the questions die down, then I'll sign off and you won't see my ugly mug after this. How does my workload compare? I think one of the biggest misconceptions I personally think is that in the field of medicine, we think that we've got the most work to do. We do way more work and have so much more responsibility, which is true, we have more responsibility. But I think other degrees, they have so much more work as well. Even English literature, which you wouldn't think there'd be so much work, but there is. They've got to do so many essays every week, read like 5 books in one week and analyze them all and appraise them all. So the workload is different. Um, I wouldn't say medicine is any easier. I honestly wouldn't say that. I think every degree, if you're an overachiever, you're going to work hard in any degree that you're doing. The difference is theirs are 3 years, ours are 5 years. So we've got more time that we have to invest. And obviously, we've got responsibility of patients, which is different. But in terms of the workload, I can't really say. I've got non-medic friends who are in the library from like 6 a.m. to 11 p.m. at night, and they're not doing medicine, but yet they work really, really, really hard. What extracurricular curricular activities did I do? Oh my gosh, this is where it's embarrassing. I'm not a well-rounded person at all. The only round thing about me is my face shape. Um, so I didn't do a lot. I did British Sign Language to kind of diversify myself, which I'm so embarrassed to admit. But actually, I was interested in British Sign Language anyway. But yeah, I didn't have a lot of thing extracurricular activities. I mean, I used to play piano. That's not very unique though. Loads of people play piano. Most of my work, my personal statement, I highlighted all of all of the things I did and how it related back to medicine, really. But it depends on the university. Some universities really love extracurricular activities, and others don't really care. Do you think first aid training is beneficial for my personal statement? Um, yes and no. If you can relate it back to medicine, very useful. Whereas if you can't relate it back to medicine, or if you're just using it as a filler and you've got other things to talk about, I would talk about other things. MMIs. Oh, I had a terrible MMI experience. Um, the best way to go forward with these MMIs is to realize that you have to forget about each station and go into each one fresh. That's the best thing about MMIs. You can really make a different impression and start new, because this person has never met you before and doesn't know about the mistakes you made in your previous one. And similarly, they don't know how great you were in the other one, so you have to be great in them all. If the role plays are difficult, they can be difficult if the person starts crying, because there are some great actors, they actually cry on cue. But stay calm, relate it back to medicine, and think what you need to get out of the station and what you need to put forward in this station. So if it's testing your communication, make sure you're communicating with this patient and Basically being yourself, and don't do any red flag things like shout at them or laugh at them or whatnot. They can be difficult, I'm not going to lie, but practice, practice, practice. That's the only way to excel in these things. Yep, common role plays are breaking bad news, dealing with conflict, things like that. So if you just practice those things in front of a mirror or with your mum or your dad or your siblings or your friends, and practice it a few times so you kind of know what words to use. If you look online, there are so many resources and what to say and what to do. Even on YouTube, just Google some scenarios and see how they act and what to do. Oh, extracurriculars. Do you mean what I do at university extracurricular wise or when I was at school? I don't do much either way, I'm not going to lie. Most of my extracurricular things relate to medicine. If not, I just hang out with my friends all the time. I haven't got many interests, which is very sad to say. Dr. Kennedy did a lot. He's an inspiration. Um, How do you keep up with hot topics? Easy. BBC News. I used to visit that website every other day, if not every day, when I was applying to do medicine, just to make sure I knew exactly what was happening, what was going on. Um, just the healthcare page. There are things like BMJ articles. There's also a Medic Mentor magazine. There are 4 every year that are released, and it has great articles and pieces that you can read about that relate to the hot topics in medicine. I personally used the Guardian page and the BBC page. Yeah, don't read the Sun, don't read the Daily Mail. No, steer clear. You can read that in your own time for all the celeb hot goss, but not for medicine. I'm really surprised how many questions I'm getting. I feel really happy. Dr. Kennedy's doing a great job at answering them all so quickly. What A levels did I do? I did maths, biology, chemistry, and philosophy and ethics. And I dropped philosophy and ethics at A2, and I just did biology, chemistry, and maths. They're the classic ones. I didn't do them because I had to do them. I did them because they're the ones I enjoyed the most. That's the main thing. Do the ones that you enjoy the most, because you'd be surprised. Not every university wants you to have maths and physics and biology, surprisingly. Most universities want you to have chemistry. So if you look on the prospectuses and you look online, all of their requirements are set out there. So apply to the universities that best fit you and play to your strengths. Don't apply if you're going to get a B in physics, whereas an A star in English lit. Do English lit, get that A star, and apply to the universities that don't expect you to have a physics A level. That's what I would say. With Latin, your fourth choice doesn't really make a difference. If you're doing 4 A levels, I mean, your fourth choice doesn't make much of a difference in most universities. Some universities want you to have a B at least, but they don't really care what that fourth subject is, as long as it's not like critical thinking and general studies. No university accepts that as a subject. So yeah, the fourth subject, no, doesn't really matter. It's your 3 subjects that they put all the weight on. If you really enjoy Latin and you're great at it, go for Latin. There are some universities that really like a language. Actually, maybe it's a modern foreign language. Maybe Dr. Kennedy can say if this is correct. But I'm pretty sure Imperial love their third A level to be in a language. Um, so yeah, play to your strengths. Okay, modern foreign languages. So Latin isn't one of them, but it doesn't mean that they will, you know, not count that in your medical applications. You just have to make sure that you check what the requirements are for that university. Yeah, we want to dispel the myth that you need to do maths, biology, chemistry, and physics at A level to get into medicine. That is not true. If you just look online at what they require, you'll see very soon that that's not true. If you want a full list of what every single university requires, Medic Mentor has a book that puts all that information out there, so it's much easier to peruse through. That's an option. So if I had to choose between English Lit or Latin as a fourth, which would look better when I am applying? The one that you get the highest grade in. Like I said, they don't count your fourth one, and most universities don't care about your fourth one. There are some universities that want you to have a B in your fourth one, but they don't really specify what that fourth one should be. Um, yeah, Dr. Kennedy just said the one that you're going to get the highest grade in, do that one. What did you consider when choosing what medical school to go to? So I considered mostly location wise. I'm really attached to my family, so I wanted to be close by to my family. So most of it was based on location and also entry requirements, and UK CAT, because I was not willing to do BMAT. Couldn't be bothered really. So I just applied to UK CAT universities that matched all of my entry requirements in terms of the A levels I got and close to home. Yeah, choosing medical schools, there are so many things that you can base your choices on. It's crazy. Now there are 32 medical schools in the UK, and you only get four choices, so it's not a lot. Choose them wisely. Just choose them based on your strengths. That is the biggest tip. Golden golden tip there. Choose the ones that play to your strengths and match you as an individual. Oh yeah, the book that I said from Medic Mentor that lays out all the information about what each medical school in the UK requires in terms of A-level results and UK CAT or BMAT scores, etc., or IB scores. Sorry, I'm excluding all the IBs and Scottish hires. That's in the Medic Mentor book, the Medical Schools Compendium, and you can buy that online at the Medic Mentor website. How do you cope with stress? Oh, that's the golden question, million-dollar question. Um, how do I cope with different ways? I am a very religious person, so the main way I cope with stress is through religion, praying when things get tough. Or I call my mum. I'm like, Mum, got problem ABC, help me out. Talking to my friends. The main thing about dealing with stress is you really need to talk to somebody about it. If you, it's a dark path to go down. I'm not saying everyone's going to combust, but it's really important that you talk to somebody and you highlight it. There are organizations within your university that are just there to support students. So if you consult them, they will help you. I've got friends who have really struggled in medical school. It doesn't even have to be about medicine. It could be your something happening in your life that's impacting you in a really big way. You talk to these people and they can really, really help you. I know it's so cliche, talk to somebody, but seriously, you need to talk to somebody about it. Get it off your chest, because so many solutions that are out there that you're not thinking. When you're really stressed out, you don't think that there are solutions out there, that there's light at the end of the tunnel. You just think problem after problem after problem after problem, just building on you. But once you let that out, you'll get a really good response from a third party who will help you through it. That was a question I got at my interview, actually. How do you cope with stress? And I said the religion thing, and they kind of like, well, first I said something else, and then they counter argued with me saying, because at the time I was a very keen exerciser, um, and I said, oh, I would deal with my stress exercising. And then they went on to say, well, if you've got a patient at 3 a.m. Who is going into cardiac arrest and you're really stressed out, you can't just start exercising, can you? So what would you do? And I was like, oh my gosh. And then I brought in the whole religion aspect and et cetera, et cetera, et cetera, and how if I'm really stressed, I would consult my seniors and ask for help. So yeah, that's a good question. And that's the end. Thank you so much for tuning in. And you're free to watch this again in your own time if you really want to. And feel free to contact us on the Medic Mentor website. You can add us as friends, send us messages, and we're sure to answer them, hopefully. Any more queries, yeah, like I said, just go on the website. And if you're burning to have an insight into medicine, we've got events that we run throughout the year. Just look on the website, it's all there. Thank you very much, guys. It was really great to chat to you all, and I hope this has helped you in some way or another. Thank you. Bye.